Good evening to all the viewers who are watching live and will be watching on the recorded version. We are very much sorry for this delay as we were facing some technical issues, and now we have joined with you. To those who ever watching on Instagram live, let me just tell you one thing, that this stream from Instagram will will stop after 1 hour. So we are just requesting you, if you're watching from Instagram, do come back to YouTube link, which is which is in our WhatsApp channel. You can go, or else you can just go to and search NIH Alumni Association on YouTube, and you can just watch the live stream over there. And also you can just go from Facebook, whatever you have with yourself. So again, sorry for the delay, and I take some few times to just explain you about the participation certificate, since it has come to life that the means the credit score, like about that. So for that reason, NCH has now legalized that CME, means you have to attend all the CMEs. So many of the doctors have this dilemma that the CMEs are being organized by some of those patent companies. But let me just tell you, they not only do, we also do that. So those who are like that have joined this stream. Thanks for coming by. And let me just tell you that after a few moments, means after 15 minutes of this stream, the auto regeneration certificate link will be live to you. The description and the link is in the description. So just go click on that, fill up some of the details, and do make sure to give the proper email account, because that proper email account should be that account where you will get the certificate. So with this, and one more thing to say, again, thanks to all for joining. And without wasting any more time, let's just jump into our 30 seconds countdown time as usual.
Good evening, all viewers. Post Durga Puja, this is our 103rd CME. Good evening, sir.
Very good evening to all of you.
And we are happy to announce that our continued medical education program had been in a continuous process, and today is the 103rd episode. And on request of so many audiences, apart from the alumni of NIH, there's so many audiences of the homeopathic fraternity, we are bringing today the second episode of Dr. Rabin Barman sir's CME. He had been there, analysis of some cases. He had been there with the topic description and analysis of some cases of pioneers. And last episode was 93rd episode, and that was way back in, last episode was 97th episode. It was on 28th July. So this is the second part, a very interesting arena. And to inaugurate tonight's CME, with the permission of our beloved President, Dr. Narayan Kalyani, sir.
Please start.
Thank you, sir. We'd like to request our inaugurator tonight, Dr. Pijush Kumar Mishra, sir, who had been a senior research officer of National Institute of Homeopathy, scholar from National Institute of Homeopathy. He had been the third batch of Dip-NIH and had done several research projects in and within NIH itself. So I'll request Orko to bring on Dr. Orko Mukherjee to bring on Dr. P.K. Mishra sir on screen to inaugurate the 103rd CME.
Please go ahead.
Shubho Vijaya sir, Pranam Neben,
Shubha
welcome to NIH Alumni Association 103rd CME. Over to you,
Thank you.
Mishra sir.
Thank you. Thank you. Should I start?
Yes, yes. Please
Sure,
start.
sir.
So, first I'm giving thanks to Dr. Bidyut Mukherjee and Dr. Kalyani, President of our NIH Alumni, inviting me to be an inaugurator to start this program. Whenever we talk about homeopathy, the Hahnemann name is always coming. We cannot avoid him because he is a living charge of medicine in homeopathy. Dr. Hahnemann, Samuel Hahnemann, is a living charge of homeopathy. So the point is here that the medicine of speculation has been changed to medicine of experience by founder and master in homeopathy, Dr. Samuel Hahnemann. What we are today understanding, experiencing, in studying, in doing research, in explaining our all observations based on medicine of experience, not medicine of speculation. Medicine of speculation was prior to Hahnemann. If we visit medical journey from pre-Hippocratic to Master Hahnemann, then we'll see a lot of things we have to mind for ourselves. Initially, it was some demon, some evil spirit like causing disease. Then it comes to under the power of ministries of different churches that they are taking the care. They are taking the care of homeopathic. They are taking care of medical treatment. Then came the science, the era of science, and it is working from pre-Hippocrate to Hippocrate and up to Master Hahnemann. So, if you study very carefully, then we see the medicine, the credit of Master Hahnemann is the medicine of experience from medicine of speculation. That is very, very different part of homeopathy. It differs from others. Now, the resources may be same, but according to way of its preparation, route of application on the observations, the same resource may take different views under different experiments. I can tell you from one book on cancer book, there is one leaves, Jamaica. There is one leaves which is known as that Jamaica leaf, and what Vinca rosea. The Vinca rosea, when applied, people used to take during those days, which could control diabetes. When the scientist took this and mixed with aqueous solution, administered to animal, it did not yield any result. But when it is injected into the animal system, the rats and rabbits died. When they did the autopsy, they see there is agranulocytosis. the diminishing of the all cells, and ultimately it becomes a great remedy for cancer. And you know the name of the remedy is vincalucoblastin, one of the great remedy for adenocarcinoma. So see how the route of application, one is ingesting, and in the animal and the man, and how when it is applying in the through root, through injection, how it changes its properties. So it leads to development of different therapeutics. So different therapeutics coming from the same resources with different way of preparation, different route of application, different way of observation. So we get the different therapeutics, and the homeopathy is one of them. Homeopathy is one of them. So there is some inter alia somewhere. We will reach to that place somewhere from the mother resource to the present status. There is some inter alia. We have to excavate that. We have to explore that. We have to find out some new ways, some new avenues. Say, Hahnemann, Master Hahnemann, he also advocated your contraria contraris currenta. He also had written in his organon books under certain exceptional conditions. You use this. So some person ingested alkali, some person ingested acid, some person ingested arsenic-like products. So with the exception, rationally, you apply the contrary principles. And now, if you see the modern world, this allopathic worlds, you see the same what he advocated, they are doing this now. So you are getting all these oxygens, infusions, inhalers, all these things are not against of Hahnemann's idea. These are all things he incorporated there. Another thing is, interestingly, that I just studied doctrine of signature. The similar was like that, doctrine of signature, same contagious principle. It also is in your materia medica. It also there in during studies, during prescribing. You will see that doctrine of signature also coming to the picture. I could remember one case. She was my mother. She had a very peculiar eczema, both hands, and she did not visit other relatives' place, saying me, no, I won't go. They will not like me. It looks so ugly. So I will prescribe many medicines. Lastly, I saw that eczematous pass and the multiple pigments are there. Some yellow, some reddish, something like that. Peculiar. You know what I prescribed? The Elaf score. Still my mother is living. That symptom totally went away, which rested with her for nearly 20 years. So that is one of the examples that somebody could ask me, why did you prescribe Elaf in this case? The explanation is that is a doctrine of signature. What a coral snake looks like, the different pigmentations, I saw it in her skin, so I prescribed Elaf. So there are, see, many different ways of prescribing homeopathy medicine from different angles, not from the single angle, but different angles. And you will get the answer in your organon book, that answer that is answerable. Whenever you prescribe some remedies, some drug to certain patients on certain observations, the credit is this, that is explainable by organomedicine. That is the universalities of homeopathic medications. However, Dr. Barman's previous lecture on different stalwarts clinical practice, I have gone through. Dr. Bidyut has told me, sir, he already delivered lectures on some stalwarts clinical practice. So I went through. And I thank you, Dr. Barman. Dr. Barman is not new to me. Dr. Barman or Dr. Mishra needs no introduction. Dr. Barman was that time assistant professor of Repertory. And Dr. Mishra was the researcher come the repertorial or honorary teacher. So we had a very great communications. And to my personal feeling, Dr. Barman is very sportsman spirit. Still I remember, he is a very sportsman spirit that I admire. I hardly see the homeopathy doctors are having such sportsman spirit. So that he is acquainted with. So I thank you, thank him for that. And one point is there, when we are talking about the stalwarts, their experiences and others, why don't you speak our experience? We are also much experienced. We have been, I'm working for 30 years. Dr. Kalyani also is working for nearly 45 years. We have also a lot of experiences, and we can transmit that experience to the others. So in this regards, I have, in coming to homeopathy, I can tell you the pioneer bringing me to homeopathy was my mother. I once went to my grandpa's house, and I was becoming ill with the fever, diarrhea, all these things. My grandfather, maternal grandfather, was a homeopathy doctor, amateur homeopathy doctor. He used to prescribe free of cost homeopathy medicines to farmers. My mother took me to him, and he prescribed some medicine, and I was okay. When I came back, I told my father, Daddy, mother has gave me homeopathy medicine. Incidentally, my father was a allopathic compounder, dispenser. He got very angry. Then he showed my mother, why did you take my boy into risks of this? Why didn't you take to allopathic doctor? I could have given money afterwards. Yeah, I cannot admit you. So my father was severely scolded. But I was all right. So my father showed, no. He is not all right. I shall watch him for another 4 or 5 days. He watched me. I was completely okay. My father was becoming silent. When I became a homeopathy doctor, the same father, we are Brahmin, so we have that time we are taking care of the milking cow. Milk is very essential for a Brahmin family. That cow was very sick. Possibly there is some abortion, missed abortion. It was tearing like that, shouting like that. I was there. My father told me, you sit here. I am bringing one wooden chair for you. I have heard that homeopathy, the observation is everything. You see how he is behaving, and you prescribe some medicine. He had one book on Santosh Mandal, veterinary homeopathy doctor, published one book. Then I sat there. I saw the frequent defecation and frequent urination. So I told my father, yes.
Mr. Sir, all the viewers are eagerly waiting for Dr. Rabin Barman, sir. So after the inauguration, we have already passed 19 minutes on the inauguration. Please bring on our moderator, sir. Thank you, sir.
Who is your moderator? Dr. Pravat Kumar Pattnaik. Is it? Hello?
Yes,
Hello?
sir. Yes, sir. Yes, sir.
Let me finish that part. That is becoming unfinished. So, you see the same homeopathy medicine, same principle, is also working on the domestic cattle. The same frequent desire for urination, frequent desire for defecation, also is working on homeopathy, cattle. So the law of homeopathy is universal. You can apply it to any living creature. If the symptom did agree, you will get there the better result. You get cure. Okay. Now this is the term of moderator. Dr. Pravat Kumar Pattnaik. No. So I'm requesting him to come to dais and to explore his all experiences, all knowledges to the audience. Thank you. Thank you, Dr.
Thank you.
Pattnaik.
Okay, thank you, Dr. Pijush ji. You are my senior at NIH, and you are my friend. You are my guide. We, after 40 years, we were exchanging our thought. So this is the day when we are celebrating, we are having our discussion in the matter that Dr. Barman has had. Part one, he has completed some, these are our, so to say, pioneers prescriptions. He has collected about 400 number of such type of cases that everybody is interested to listen. In the first part, he has already told near about 40 or more than that. That's why I welcome Mr. Barman to come and explore all his own experience along with these his collections that viewers are waiting for that. I request Dr. Barman to participate.
Good evening, friends. I'm glad enough and happy enough to say something about the cases, established cases of the pioneers of the homeopathic stalwarts who are famous for the genuine Hahnemannian practitioner. Since my student life, I have collected, whenever I have read, I have collected many cases from different sources, different books, different journals, and collected as a book. In my last lecture, I have delivered some of those cases. Now let's discuss other cases. To introduce myself, I passed DMS from Kolkata, the oldest institution of Asia, Kolkata Homeopathic Medical College, and I got Dip-NIH from the National Institute of Homeopathy, and I was a teacher of Repertory up to 2004. Dr. P. Mishra, for quite some time, he was also my teacher. He was a very talented personality in homeopathy, and I believe would he be appointed as a full-time teacher from the very beginning in National Institute of Homeopathy, the students will be more benefited. However, while watching the last episode, I have seen some persons ask about my phone number. I wanted to write, but there are some disturbances, sign it, etc. I couldn't. So that's why today the occasion, I'm giving my phone number 700-307-8942. 700-307-8942. Now let's discuss some of the cases of pioneers. I have forgotten in my last lecture which cases were established or expressed. So maybe some repetition of cases. I'm sorry for that. We know that Avis nigra is a medicine, only one peculiar symptom, sensation of a painful lump as if a hard-boiled egg was lodged in the cardiac end of the stomach, that means at the esophagocardiac junction. There is a case of Dr. Richard Hughes. Many of the cases, I do like to say by his own words. From writings of Dr. Hughes, a patient of my own complained of a persistent sensation as if something were sticking in the esophagus towards its lower end under Avis nigra 3x, it cured. So the prescription based on the peculiar sensation. From all these cases, you will get that homeopathic prescriptions may be done from different angles. From proper taking of a case, one may give more importance to the causation. At that case, causation is the prime factor, or sensation, or aggravation, or amelioration, or concomitance, or thorough the case with totality. So the angles differs from individual to individual. In many cases, as laid down by Dr. Hahnemann in aphorism 153, many pioneers cured many cases by striking on peculiar symptom also. But in all cases, one strong peculiar symptom, which would be qualified either by causation or sensation or location or modalities or concomitants, is not found. In those cases, totality from the totality base, considering the present components as a whole, with past history, for miasmatic analysis, family history, personal history, and the homeopathic general symptoms, that means the thermal reaction, the desire, aversion, thirst, sweat, appetite, sleep, dreams, hemorrhagic diathesis or not, catches cold very easily or not, healing of wound easily or not, in case of female menstruation, stool, urine, perspiration, seasonal aggravation, food aggravation, time aggravation, sites of the body aggravation, etc. required, and the case may be settled by that totality. So all types of cases are available in my stock. This is the case based on peculiar sensation. And there are many peculiar sensations. You must remember the peculiar sensations are also very, very important to find out a remedy for chosen. Example, with the cases, I do like to also narrate or tell something from my own experience and collections. I am talking about the sensation as Dr. Hughes cured a case of dyspepsia by the peculiar sensation as if a hard-boiled egg lodged at the cardioesophageal junction. This is a very peculiar sensation, is found clinically in the medicine Avis nigra. See, there are some peculiar sensations I have verified in many cases, ball in the inner parts, especially either in the throat or in the rectum, ball in inner parts of the body, sepia is a very, very important remedy. Band sensation, band, carbolic acid, anacardium are very, very important medicine. Band, but constricted. Only band sensation, there are medicines, anacardium, carbolic acid, Rastox, pyrogen, etc. But the band is constricted, cactus grandipodus. Band in the abdominal region, and that is twisting from anterior to posterior, tighter and tighter, plumbum metallicum. So you must remember the peculiar sensations, causations, aggravations, ameliorations, etc. Brain feels too large, sensation. I am talking about the sensation, some peculiar sensations. Brain feels too large, glutamine is the remedy. Breath would stop as if the breath is, he will breathe it last. It will stop. Epismen, Amunkar are the important medicines. Breathing as if through a sponge, as if some obstruction is there. But the obstruction is not thoroughly, totally obstruction, as if smoky, as if obstructed by some clothes or a sponge is covered the nose. The medicine is bromium. Bubbling sensation in any parts of the abdomen, eobate, this sensation is found in Barbaris vulgaris. But I have observed and cured cases, interpretation this symptom in the pain of the lower abdomen, I mean hypogastric region, bubbling sensation, Barbaris vulgaris is a very important medicine. I see coldness sensation in the breast, medullum. It is written in the textbook, nipples, but the whole breast may be considered as I have found, coldness sensation of the breast during menstruation, medullum is a very, very important medicine. Cold needle sensation, cold needle pricking sensation, agaricus. So I have given some examples of peculiar sensations. I am very much interested to publish some booklets on causations, sensations, aggravations, and ameliorations, and the work is going on. So from those books, I am giving some examples. Enlarged sensation. As the parts are enlarged, argentum niticum and glutamine are the medicine. So I have given some examples of sensation with the case of Dr. Richard Hughes. Due to lack of time, I could not separate the cases for today's lecture. So I shall take a little bit of time to find out the cases because there are more than 400 cases. A case of hysterical fits. A case of hysterical fits by Dr. S.P. Kopikar of Chennai. Dr. S.P. Kopikar was a renowned physician of Chennai, and he served homeopathy near about 70 years. From his own writing, aconite is supposed to be an acute remedy. Aconite is supposed to be an acute remedy, but it can cure a hysterical fits of 3 years duration. After all sorts of treatment, when failed, because the disorder had started as a result of a fright. So fright ailments after not only opium, not only aconite in chronic case, but aconite is also very, very important in chronic cases too, not only in acute case. Opium is also a very important medicine. I have a case of Dr. J. N. Kanjilal, who cured another epilepsy case by opium, who is resulted from fright. About the causation, so this prescription was based on causation. The former prescription was based on peculiar sensation. Now I'm telling some peculiar causations. See, aluminum poisoning. Persons are cooking, some poor persons are generally used utensils made by aluminum. I have studied from the William Gutzman's Mathematica, long cooking from aluminum vessels may produce constipation and other symptoms, skin symptoms, etc. And it may be helped by aluminum potentized form. So the bad effects of aluminum vessels cooking. So this is a causation. Aluminum cooking used for a long time. Aluminum utensils used for a long time for cooking purpose. Carbon monoxide poisoning cause in the winter season when some persons close the doors and windows, burnt a candle or a lamp, and there may be carbon monoxide poisoning. It is heard that many occasions, in many times, persons, 4 or 5 persons together, died by such the way carbon monoxide poisoning. If the patient survives, and if there will be distress in the respiratory system, carbo-base is the remedy. Catheterization from bladder. In modern medicines, due to obstruction of the neck of the bladder or obstruction in the urethra, there may be disturbance after the catheterization. Metphos is the remedy after bad effects of catheterization. Chilling when overheated. In hot summer weather, persons used to take cold drinks, ice cream, cold coffee, refrigerating water, may be followed by fever, coryza, headache, allergic rhinitis. There are many medicines according to symptomatology, but one of the most important medicines, which I have repeatedly verified, arsenic alba, other medicines are bryonia, etc. Climacteric ailments after, this is also a causation. Many homeopaths, many physicians overlook the age of the patient. When a lady has come to your chamber suffering from headache or piles or abdominal colic or irregular uterine hemorrhage or anything else, you have to look the age, whether it is within 40 to 50, and ask about the menstruation, whether he has crossed the climaxes, I mean the menopause, I mean the change of life. So many complaints after climaxes, very, very important medicines. To utter surprise, I have seen in my practice, 4 medicines are very, very important. Of course, symptoms must be observed, other symptoms must be looked after. The 4 medicines are sepia, sanguinaria, lachesis, graphitis, and also sulfur. These 5 medicines. So climacteric ailments after is one of the strongest cause of different diseases when the lady belongs to age near about climaxes and there is either irregular or menstruation with gapping after 1 or 2 or 3 months, etc., and with other symptoms, you must look after the medicines. Frequency of urination. Frequency of urination, painful or painless. You are prescribing different medicines. You are looking after your maitre medica. You are looking after your repertory. But you have not observed the lady just recently married or not. Before 3 days or 4 days or 5 days or 7 days back, if she got married, your medicine is staphylococcus. All these are examples I am giving for causations. Causations are much more important than all other legs of a case taking. Cause. What's the cause behind it? You know, there is a case of Dr. H.R. Pathak who cured 40 years durations diarrhea by CPR because the diarrhea had started 40 years back from the next day of the marriage ceremony. There are customs when the bridegroom enters the persons of father-in-law's house offered a glass of milk. In that case, in that patient, also offered one glass of milk, and probably the milk was very concentrated, and he had an urge for stool. But in the midst of the marriage ceremony, he had to control the urge, which was followed the next day diarrhea, and which was continued for 4 decades, and which was treated by a variety of doctors without any good result. Dr. Pathak emphasized the rubric diarrhea, boiled milk after, and he found in Bogar Bonigoson's repertory, Nux muscat and sepia, and out of these 2 medicines, he prescribed sepia. So causation, I repeat, causation is very, very important in every case. These causations are of 2 types, mental causations and physical causations. Mental causations are much more important than physical causations. Mortification of that. Many cases we are observing every day in our daily practice are caused due to mortification, admiration, reproaches after, insultation after, injustice after, rude behavior from others after, grief after, hatred after, suspiciousness after, causations, grief after. There are many medicines. One of the most important medicine is phosphoric acid. From grief, a person may develop diabetes mellitus. I have seen in many cases. And the formula, and the causation and the etiology written in the practice of medicine by the modern physicians many times not correspond with the causations of the personal man. So causation is very, very important, my friends. And what is totality? From the first year, a homeopathic student is learned from their teachers totality of symptoms. What is totality? The actual meaning of totality is not understood by many physicians, by many teachers. Totality does not mean the numerical total. I say totality does not mean the numerical totality, not the quantitative totality, but the qualitative totality. 50 symptoms, 60 symptoms are not the total. Totality should collect it from the total case taking, from the holistic approach, from the total individual visualization of the patient. 2 symptoms may be total. And medicine may select from those 2 symptoms. Not by mechanical repertorization, not by mechanical repertorization. 60 medicines are coming, 50 medicines are coming, 30 medicines are coming. No, never. Repertorization does not mean the numerical total. Repertorization means selection of medicine means the qualitative total. So causations are very, very important, my friends. Darkness, fear from, darkness from, rain from, thunderstorm from. So peculiar sensations, aggravations, ameliorations are very, very important, and these are the actual lakes of testing. And these lakes, as mentioned by Dr. Clemens Maria Prince Baron von Bonninghausen, by the Latin language, quis, quid, ubi, cur, quomodo, quanto, quibus, auxilius, English meaning of which is causation, location, sensation, modalities, concomitants. And that's why Bonninghausen is to say that the man of law and logic, the man of analogy, the man of interpretation, king. So causation. I am giving example some of the causations. Silesia abuse of from. A person had taken Silesia CM many doses for few months, and the fistula for a fistula. On finding the books, I have found that fluoric acid is the antidote of abuse of Silesia. Like that. So I have given some examples of causations. Now I am coming back to other cases of the fibers. A case of throat troubles by Agaricus muscarius, cured by Dr. Union of Calcutta. Dr. Union was a famous homeopath at the beginning of 19th century. He practiced at Calcutta, and at that time he was called at Banglar Hahnemann. Dr. Union was originally a man came from Libya. His father was a police officer servicing in Calcutta Police, and he passed homeopathy and practiced and became a renowned homeopath at that time. Many cases of union with me, many cases of Dr. Mahendralal Sherkar with me. I am citing some of them. The case of throat troubles. A boy of 14 from Benares was suffering from spasms in the throat. A boy of 14 from Benares was suffering from spasms in the throat and emitting an involuntary, peculiar sound of a choking character for about a year. He had been under the treatment of many doctors and many Kobirajes, and lastly kept under me. I prescribed Agaricus muscarius 200 only one dose. After a few days, the boy showed signs of improvement, and gradually the spasm stopped and he was cured permanently. I prescribed Agaricus muscarius considering the peculiar symptom, spasm of the throat. He interpreted it. Agaricus acts over the muscles. দেখো তো একটা ফোন এসে ছেলেগুলো এমন অসভ্যের মতন ফোন করে, কাটতে গেলাম সে কাট সরলো না, মাঝখান থেকে ফোনটা কি হলো এটা জানানো পর্যন্ত। So a phone came and I was disturbed. So considering the spasm of the muscles, as the Agaricus muscarius has action over the spasm and convulsions of the muscles, everyone generally consider Agaricus muscarius for spasms and convulsions. So, by interpretation, spasms of the throat muscles, Dr. Union prescribed Agaricus muscarius only 200 on dose, and he cured the spasms and spasms of the throat for which the child was suffering for last 1 year. A case of Dr. Yunan. Once again, a case of Dr. Yunan of Calcutta. The case is ovarian tumor. He cured an ovarian tumor by Alumni. A married middle-aged lady of Sitaram Ghosh Street of Calcutta was suffering from what was diagnosed as a growth of a tumor in the ovary. Her menses were irregular and faulty, etc. All her symptoms aggravated during the full moon. Already I have told you, the aggravations are very important, and all the cases which I do like to show you are based either causation or sensation or modalities or concomitants. In this case, Dr. Union gave importance to the aggravation of the pain and complaints of the ovarian tumor during full moon. Observing it, I prescribed alumina 200, 2 doses. This medicine produced slow but sure improvement, and she began to recover, and a second dose finally cured her in 3 months' time. You know, in alumina, it is clearly written, the action is very slow. Sometimes the junior homeopaths, the junior practitioners, does not follow the action of a remedy. Alumina action is very slow. Lycopodium action is very slow. It takes time. So many times, many physicians do good prescription at the first time, I mean the first prescription, but they blunders their second prescription, either not waiting or giving haphazard medicines, etc. So alumina 200 cured the ovarian tumor of a lady. A case of epileptic fit cured by Dr. P. Shankaran of Mumbai. You know the P. Shankaran, that means the great Shankaran, father of Dr. Rajan Shankaran, was a talented homeopath who died very early age by the cirrhosis of liver. The case is very small. It is based on aggravation. I have shown a case, aggravation from full moon. I have shown a case based on sensation. Now this is the case, aggravation from taking potatoes. I was once able to cure a case of epilepsy where the patient reported to me he got more seizures if he took potatoes. Simply I prescribed alumina 200, few doses, and the tendency of fit was cured. A case of Dr. P. Shankaran for palpitation. One of my patients came to me with several symptoms, all looking like lachesis. Lachesis, however, failed to give satisfactory result. Then she gave me a good symptom that she invariably developed palpitations after bath. It did not depend upon the exertion of the bath, nor on whether hot or cold water was used, but upon the bath itself. When I refer to Kent's Repertory under the rubric palpitation, bathing aggravates, only one drug was found, Amonkar. And Amonkar completely cured her whole disorder, including her eczema. This case shows Repertory many times help us to find out the peculiar, uncommon, rare symptoms. A very interesting case of Dr. S.R. Pathak. You have heard the name of Dr. S.R. Pathak of Mumbai. Like Bogart, he had a habit to talk very less a very less talking person, a very saint type person, who was a converted homeopath from MBBS. He cured a case of cold sensation in the back by ammonia. We know that ammonia possesses the symptom cold sensation in between the scapulae or in the middle of the back, and burning sensation in the middle of the back, phosphorus. In my days of transition, I was mainly practicing biochemic medicines. With allopathic practicing, he used to use biochemic medicines. Then once a middle-aged gentleman consulted me for a peculiar sensation. He told me that he had a cold sensation like a piece of ice between the scapulae occurring frequently. It is used to occur many times a day and used to last a few minutes each time. He had consulted several doctors and had taken mass treatment, but without any relief. I prescribed for him 3 biochemic remedies in various potencies for a week, also without relief. At that time, I did not know homeopathy, but I had Harrington's Clinical Materia Medica with me. One day, I casually opened the book, and it opened at the page of Ammonia. And the first sentence that struck me was that this remedy covered the sensation of ice between the scapulae. So I ordered Ammonia 6 and gave the patient this remedy 4 times a day. In 1 week, he got rid of the trouble, some feeling. Since then, I started the practice of homeopathy. So, Ammonia is a milestone for starting practicing homeopathy by Dr. S.R. Pathak. A case of puerperal convulsion by Dr. S.P. Kopikar of Chennai. I was with my uncle, who was an old homeopath. One day, suddenly a man came runningly and said, "Sir, my wife is having fits which started immediately after she delivered." Uncle asked me to send a dose of amyl nitrate or amyl nitrite, 1 ml, which was to be rubbed on the tongue of the patient. The boy ran back with the dose, and within 10 minutes he returned and said, "Sir, as soon as we rubbed the medicine on the tongue, within 1 minute or so, she opened her eyes and said, 'What happened?' I asked my uncle how he had picked up amyl nitrite in such an emergency case. Uncle replied, 'Read Alan Skinner.' I duly looked Alan Skinner's book and found that the last sentence under amyl nitrite was puerperal convulsions immediate after delivery. So this is called the peculiar symptoms, which is more important than 10 vague generals. On a strong peculiar causation or sensation or aggravation much more important than 50 vague general. On the other hand, Kant has stated in his philosophy, which is one of the greatest classic literature in the world, one strong general can overrule all the vague particulars. So vice versa. One strong general can overrule all the vague particulars, or one peculiar strongest particular may overrule all vague generals. In this connection, may I say that cicuta has convulsions before, during, and after delivery too, but the convulsions of cicuta has its own peculiar nature, that is opisthotonous. The patient turns back. This is and the character of the convulsions is the worst variety, a very bad variety. So, cicuta. Hyosomas has also convulsions during and after delivery, but amyl nitrite convulsion starts immediate after delivery. Immediate after delivery. So convulsions after delivery, immediate after delivery, amyl nitrate, never forget. A case of Dr. Union of Calcutta, virulent skin disease cured by anacardium. A case of Dr. Union of Calcutta, virulent skin disease is cured by anacardium. One young man was attacked with a virulent type of skin disease, which was diagnosed as contact dermatitis from the Medical College of Calcutta. The patient suffered intensely from burning and itching of the skin, which increased on scratching. He had grown very nervous and was very anxious about his cure. Anacardium 6 was prescribed, which made marked improvement. Then 200 was given, which produced wonderful result, and he was completely cured. Anacardium has also great action over virulent type of skin eruptions, especially for vesicular eruptions like Rastocks, which is intensely, never mind, my friend. A case of Dr. S.R. Pathak. Already I have demonstrated on case of Dr. S.R. Pathak. This is another case of Dr. S.R. Pathak. A case of jaundice. A case of jaundice cured by Dr. S.R. Pathak of Mumbai. A patient of Dr. P. Shankaran, narration of Dr. S.R. Pathak, a patient of Dr. P. Shankaran developed a mild attack of jaundice. By the by, Dr. P. Shankaran considered Dr. Pathak as his own guru. Whenever he failed, he didn't come to final clue, he consulted Dr. S.R. Pathak. This case is such a case. A patient of Dr. P. Shankaran developed a mild attack of jaundice. One of the prominent symptoms he had was a flat, dull, or watery taste in the mouth. This would increase as he felt hungry. The bad taste in the tongue was increased when he became hungry. But after taking food, the taste would become normal at least for an hour I prescribed China as it covered the blood taste and appetite improves on eating, but this has no effect. I was then consulted Repertory and found the two symptoms taste dulled, and eating amelioration. Anacardium is the remedy. I prescribed anacardium, which brought about immediate improvement. So prescription based on two peculiar symptoms, taste dull and eating amelioration, was the confirmatory symptom to select anacardium. So amelioration is also a very, very important factor to prescribe our medicines. Amelioration. Some of the peculiar ameliorations in this connection I am telling you. See, some peculiar ameliorations I am telling in this connection. You have already seen, you have already heard in this case that amelioration by eating. Amelioration by eating is a very, very characteristic symptom of anacardium. Even in dyspepsia, in headache relief by eating anacardium, lycopodium, etc. are very, very important medicines. I am telling some important ameliorations in this connection. Bandaging tightly ameliorates headache, lacks dipolaratum. Closing loose amelioration, not only lachesis, calcarea carb is also very important medicine. Coitus or intercourse amelioration, many symptoms. Many symptoms I have observed clinically in my practice, coition amelioration, conium and mercurius are the medicines. And coition aggravates. The most important medicine is sepia, calicar, nectramute, argentum nitricum, ambragridia, graphitis, etc. Cold drinks amelioration. Cold drinks amelioration in abdominal colic or cough or anywhere, any conditions, causticum, bryonia, phosphorus, bismuth, pulsatilla are the important medicine. Arterial leaching relieved by cold application, pulsatilla is very, very important remedy. Of course, always we look after the other symptoms. Cold application, amelioration only in eyes, serum. Colors or bright light amelioration mentally, stramonium aggravates phosphorus, conium. Darkness amelioration in mental condition during headache or any condition, patient prefers darkness. They want to switch off the light. Conium is the remedy. So amelioration is very, very important side by side, apart from aggravation too. Whenever the consolation in amelioration, pulse is very important. Crossing limbs amelioration. Crossing limbs desire during sleeping, rhododendron, But crossing, whenever the patient is sitting down, crossing the limbs ameliorates, sepia is the remedy. Diarrhea ameliorates, nectrum sal. Darkness ameliorates the head pain, sanguinaria, sepia, cydicia. Driving car or car riding amelioration, many of the complaints, nitric acid is very, very important. Electricians amelioration, many complaints. I have the case by someone. Electrician amelioration, he prescribed carbobase, and carbobase is the medicine, electrician amelioration, and also sanguinaria too. Going without regular meals amelioration, nectar. Hanging down limbs amelioration. When the patient sits, patient wants to sit in a high chair or a high bench, and he desires to hang down the legs. So hang down limbs amelioration, conium is very, very important. And hang down the limbs aggravates. The most important medicine is calcarea carbonica. Head elevated amelioration. Head elevated by high pillow ameliorates arsenic alba and pulsatilla. Holding the breath amelioration, I have the case, it is given in Bonington's repertory. Holding the breath amelioration, complaints, any complaints, belladonize the cemetery. Any kinds of heat or pagdil aggravates nitric acid. Ice cream amelioration, the gastric pain, phosphorus. So there are many. I have already collected. I want to publish all these symptoms. I have given some examples. Rocking amelioration asthma. That means the patient with sitting to and fro, back and front, cadicar. Rubbing cheek amelioration, toothache, mercurius. Drawing ear, amelioration, mesothelium. Storm amelioration, storm after amelioration. During a storm aggravates, but storm after amelioration, rhododendron. Tea drinking amelioration, digital use. Thunderstorm during amelioration, many complaints and cheerfulness, carcinosin and CPR. So there are many important amelioration. Urination amelioration, gelsemium and ignatia. Urination during amelioration. Walking fast amelioration, walking fast amelioration. Tarantula. Walking slowly amelioration, Hiramme. So I have a vast collections. I have given some examples. Now let's come in other cases of the pioneers. A case of mental cruelty. A case of mental cruelty cured by anacardium by Dr. S.P. Kopikar of Chennai. 3 years old son of a couple, extremely cruel. He used to take pleasure in killing ants and cockroaches and used to hurt younger children of neighbors. They had tried some treatments, including psychiatry, with no benefit. They had actually come to me in connection with some other patient. The parents of the child came to Dr. S.P. Kopikar in connection with some other patient and asked me casually if homeopathy could do anything or something for such cases for their child. I said, we had remedies for cruelty which can cure the boy. 1 dose of anacardium 1000, 1 dose of anacardium 1000 stopped his cruel mentality and habits. So this is the prescription based on peculiar mental symptom. I have lots of cases. A case of peripheral neuritis of the leg by Dr. A.S.R. Pathak of Mumbai. A case of peripheral neuritis of the leg. Once I treated at Pune a case of peripheral neuritis of the leg. The neuritis was relieved both by eructation and by passing flutters. The pains are also relieved by heart pressure and movement. The patient had already consulted an eminent allopathic physician but had found no relief under his prescriptions. I combined the rubrics, flatulence, up and down, passing amelioration in Bogar's synoptic key, page 79, and pressure amelioration in Bogar's synoptic key, page 27. Bogar's Dr. A.S.R. Pathak was a very fan of Dr. Bogar. And Dr. Shankaran too. Dr. Shankaran and Dr. Bogar are the two famous homeopaths, was very fan of Dr. Bogar. Dr. Shankaran published on pocket repertory, and he dedicated the book to Dr. C.M. Bogar, with mentioning the words, a homeopath of Himalayan caliber. A homeopath of Himalayan caliber. Dr. Bogar, given much more importance, he is the first man who given much more importance to the modality. He strongly demanded that modality is much more important, even sometimes, than the mental symptoms. And among the modalities, he given more emphasis to the time modalities. And it is very correct. It is very absolute. It is more authentic. It is more precise. It is more reliable. Because the mental symptoms, it is very difficult to elicit who is actually angry, who is actually sympathetic, who is relieved by consolation, who is the root. It is very difficult to elicit. But the modalities, especially time modalities, is more specific, more accurate, more reliable. As we have seen, the 7 AM aggravation, Eupiterium perpoliotum, Podophyllum, 9 AM aggravation, Chamomilla, 10 AM aggravation, Nectarmute, 11 AM aggravation, Sulfur, 12 noon or 12 to 1 noon, Arsenic alba, 3 PM aggravation, Belladonna, Epismel, Thuja, 4 to 8 PM aggravation, Lycopodium, Macpos, Helleborus, Colocin, 9 PM Bryonia, 11 PM Cactus grandiflorus, midnight Aconite, Arsenic, 2 AM 2 to 4 a.m. Kalikar. 3 a.m. Kalikar. Amankar. 4 a.m. Podophyllum. 5 a.m. Nectan salt. So time modalities are more specific, more reliable, more authentic, and more precise. So that's why they have given importance to Bogart and his time modality. Now the patient had already consulted an eminent allopathic physician but had found no relief under his prescription. This is the case of peripheral neuritis, already I have told. The case of Dr. S.R. Pathak, I am sorry, I was debated to say something about Dr. Bogart. I combined the rubrics flatulence up and down, passing amelioration, and pressure amelioration, and found urgent amniticum is the drug. The drug completely relieved the patient. Now, a case of Dr. Sarabhai Kapadia. A case of Dr. Sarabhai Kapadia of Mumbai. He was also a very, very renowned physician and a very respectable person. Once a small boy was suffering from an eruption on the face. Once a small boy was suffering from an eruption on the face, which was very painful, and he was weeping bitterly. He had been in great agony for 5 hours. The eruption was small, but the aching was over the whole of the face. I had given the boy arnica, and the pain subsided in 3 minutes. And within half an hour, he was normal. While studying at Calcutta, the renowned physician and the disciple of Dr. James Tyler Kent, Dr. B.K. Bose, had taught us that pain in the whole body because of a boil indicates arnica. And while a large swelling for a small boil needed rash toss. The case of Dr. Margaret Tyler. Epigastric, it is a case of epigastric colic. A woman of 20, he cured the colic by carcinosin. A woman of 20 complained of colicky, severe colicky epigastric pains, which began at the age of 8. The attacks had become much more frequent and more severe during the previous year. Investigations are all negative. Colocin 3x was found to be an effective remedy in relieving the pains, but despite careful constitutional treatment, the number of attacks, about 1 in 2 weeks, was not reduced. There is a strong family history of cancer, so considering the blockage, 1 dose of carcinosin was given. He had been helped by carcinosin. Another case of carcinosin by Dr. S.P. Day of Calcutta. He was a very sincere, eminent classical Hahnemannian homeopath, Dr. S.P. Day, who never surrendered by anything. instead of classical single medicine homeopathy. His case, a behavioral problems. A young boy of 13 became a consistent problem to the parents regarding his obesity, education, temperament, and appetite. Such an abnormal accumulation of fat at these ages, despite regular physical exercise and active outdoor games, is rarely met with, nor do we commonly come across such a voracious eater. With the least inclination to study, he used to react violently to any suggestion or persuasion. The manifestation of his anger would terrify everyone around him. Considering the abnormal obesity to be a result of some fault of metabolism, my attention was drawn toward the basic incoordination that ran through every fiber of his mental and physical predicament, and not to be lost sight of was his mental feature, the extraordinary irritability guided by these as well as some other symptoms. Carcinosin 200 was given. To the utter surprise and astonishment, the child improved slowly. He had taken interest in studies and became very gentle, obedient, and active. The appetite was gradually returning to normal. Carcinosin 1M was given after about 4 months, and the boy became normal in all respects. Now let's close to this cases of pioneers. Many cases are with me, and further other scheduled dates, we shall meet together once again. So thanks all. May I stop or close my delivering pioneers case chapter.
Hello, Dochi. Uh, Thank you, Dr. Barman, for your nice deliberation. As you have told that the one single symptom of outstanding character is very, very important than a number of symptoms that you are taking from the patient. And the pioneers you have mentioned, now that they are genuine and your collections are very fine, and this will enrich the mathematical. Uh, and the many things you have also mentioned, those are very significant as regards the causation, as regards the sensations, as regards the modalities, and particularly time modalities, also causative modalities, and all these factors somehow enrich the mind of the physicians, those who are in touch with you, also watching over this. CME. And one important is that very important is the concomitant is a very important symptom that we expect that you should elaborate it in the your next speech, because component accompaniment symptoms or concomitant symptoms are very important clue to select drugs. And I again thank you. You should build up this habit of developing such a good mathematical in future. And any sorts of problem you are bearing with this, you must have to also contact with us, and we'll also in touch with you to to give any sorts of help and to in the academic area. So thank you all of the viewers as well as the. I thank our inaugurator, Dr. Pijush Mishra and Dr. Uh, Dr. Mukherjee and Dr. Kalyani and Dr. As. And I hope this CMA to continue to enrich the knowledge of all the homeopaths as well as the alumni. Thank you all.
Thanks, Dr. Saib. Thank you very much.
Thank you, Dr. Barman and Dr. Pattnaik, sir. Orko, do we have Dr. Kalyani and Dr. Pralay on the studio? Dr. Mishra is there in the studio. Dr. Kalyani, sir. Over to you, Dr. Kalyani, sir.
I should not say we thank you, but we are really grateful to two of our seniors, my senior brother, Dr. Pravat Kumar Pattnaik and Dr. Pijush Mishra, for nicely inaugurating, giving his experiences, especially regarding the labs, to Dr. P.K. Mishra and Dr. Pattnaik for nice moderation. What should I say regarding Dr. Barman? He kept no space to add something. We are really very much thankful to him. Today's CME by Dr. Barman seems to be adding fuel to the fire of our confidence. We are having many things, but we are simply little lacking on our confidence regarding homeopathy, and we feel less proud of being homeopaths. But today's presentation by Dr. Barman seems every way the confidence and proud of being an homeopath. Probably he was giving a speech for a lengthy period by standing. So far I can assume, I can guess. His appearance, his look and speech was full of confidence. All of us must have this type of confidence. Yes, we have seen, we have heard, we have read, we are confirmed that particular cases can be cured by homeopathy system of medicine. But Dr. Barman presented us before us. He's having many stock. Our earnest request to him to provide many more to increase our confidence and to feel ourselves proud of being homeopaths. See, we can only feel proud if we are proud of our history. What he told by our pioneers, that is history, homeopathy, history of recovery, history of cure, and for those recoveries only, for those peoples only. Today, government is providing funds, government is providing commissions, government is providing all sort of aids. Government has found one separate department, Ayush. So all these achievements by the government, by the peoples, by us are simply because their devotions, their struggles. As Dr. Borman has cited, we are very much thankful to him. To again, I am telling it is simply addition of fuel to the fire of our confidence. We have cured many cases many years before. We are curing and will be curing many cases. especially those your cases are obstinate, refuse, incurable, idiopathic, iatrogenic. These cases are considered by the modern system of medicine where we are free to treat. And we have treated, we have cured. Still we are cured. So many, many thanks. This is an asset of our CME. And our request to Dr. Barman, your journey from different solvers, from Kolkata, Chennai, Bombay, and the other countries solvers. Fantastic journey. Carry on, please, brother. You are our proud, and we are expecting wholeheartedly that your contribution regarding these affairs will be more and more in near future. Thank you very much to all of you. Many, many thanks those who have and stay on the screen. We'll be observing this CME in near future. Thank you to all of you, and refer to Dr. Mukherjee. Yes, Mukherjee to conclude. Thank you very much.
Thank you so much, Kalyani sir, Dr. Pravat Pattnaik sir, Dr. P.K. Mishra sir, and obviously our beloved Dr. Rabin Barman sir. Uh, our beloved senior come very close, Dada. Dr. Ravin Barman sir, it's our request from Alumni Association. We are proud to have you as an alumnus of NIH, and your confidence, as Kalyani sir and other our moderator and inaugurator had been saying, that boosts immense confidence among the homeopaths across the globe. And for all the viewers over here, it's a noble uh, journey what Dr. Burman had started since last few years. I had been in touch with him through the media and through the social media and electronic media, that he has been trying to promote homeopathy, and that also Hahnemannian homeopathy, through his lectures, through Facebook, through electronic media thoroughly. And that had been immense institutional task which he has been taken for last few years. And he had been producing a lot of quality single medicine prescribers. That's our basic motto, and we all look forward and we all pray to God that people like Dr. Rabin Burman will help us to propagate and flourish homeopathy in the days to come. I'll request our beloved Dr. Rabin Burman sir to be here sometimes in the month of February or March, according to his convenient time, to give the part 3 of this CME. That is his part 3 of description analysis of cases of pioneers, part 3. I'll request him to give his time well in advance through his convenience, and on request of so many live chats we are getting through Facebook, through Instagram, and through YouTube, that they want to hear for more. So we are proud to have you with us. And now from the Alumni Association, it's an announcement to all the alumni and well-wishers of NIH across the globe that in December, we are sure to have a get-together at NIH itself. I'm not saying an alumni meet, it will be a get-together, and we are working on the modalities of it. But before that, there will be a get-together at Delhi, and get in touch with Dr. Pralay Sharma for the Delhi get-together, Dr. Tushar Mittal, Dr. Mukesh Singh. The details will be available in the WhatsApp and the other Telegram groups. And for the alumni, not the alumni meet, but the get-together on the eve of 49th birth anniversary or the foundation of National Institute of Homeopathy, well, let's all come together and be at NIH. The date we'll discuss and we'll finalize on discussion with the authority at church. So, with this and with permission of our beloved Kalyani sir, Orko, do we have any questions for our speaker tonight? Orko? I don't think there are, because Dr. Burman had almost explained everything. Orko, do we have any questions? No, no such questions. Everybody greeted Dr. Barman. I'll request Dr. Rabin Barman, sir. Dada, can you give us another date in the month of February or March?
No,
2nd or
sure,
4th on Sunday?
sure.
Thank you, Dada. Thank you so much. We are
Yes,
eager to hear from you. And with this, we'll be returning to our backstage editor, Dr. Orko Mukherjee. Over to you, Orko.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you have enjoyed, do make sure to give us a like. Share this with your fellow means fellow homeopaths and also your students or your seniors you have. Do share and do make sure to get your e-participation certificate. The links are in the description below, and with for that e-participation certificate, by the end of this CME, means the live stream part of this CME will end, and the form link will end after 5 to 10 minutes or after 15 minutes. So if you have not taken your e-participation certificate, so go take it now. It will turn off in around after the end of this live stream, after the 15 minutes of the end of this live stream. So again, do make sure to give subscribe us for more content like this. And if you have, again, I want to say, if you have enjoyed, all the viewers who are on Facebook, make sure to subscribe us on YouTube, and all the viewers on YouTube, do make sure to subscribe, means like our page on Facebook. All the links are given in description. For Facebook viewers, it's given in up, and for YouTube viewers, it's given down. So with this, again, a good night to all of you. Wish you a very good night, and see you in our next CME. Until then, it's me or Mukherjee with you. Bye.